Right now, I'm here to present, again, Delegate Michelle Guyton from District 42B, Baltimore County, House Bill 657, and ask for your favorable report on this bill. This bill is designed to assist the consortium that was put into place by the blueprint legislation to establish guidelines to our 24 systems for the student questionnaire that is filled out by parents or guardians at the beginning of every school year. There is a lot of misunderstanding about this bill, so I will say simply this bill puts into place a behavioral health advisory group to work with the members of the consortium on coordinated community supports already established to help develop the types of questions that need to be asked on the behavioral health questionnaires. One of the big misconceptions about this bill is the fact that the word screening is in it anywhere. The reason that the word screening is there is because that is the term that was used in the blueprint when it referred to what we really meant to say, I believe, after talking a lot with Alistair, is the questionnaire that schools are already giving out. And just for an example of why this is important, you have actually been sent different questionnaires from different counties and some of your information. I won't call any out. I definitely won't call the ones that aren't doing a great job out. I will say that Baltimore City and Howard County have fabulous intra-student behavioral health questionnaires. They ask everything from, has the child had a head injury? Does the child have early trauma? Do they have a member of their family who is institutionalized or an inmate or has been a member of the gang? So they really and they really delve into a lot of the things that might affect children's behavior and for which they might need extra supports, but that the parents might not ever know to contact the school about. And of course, this is all purely based on parental reports. So no one has to give out this information. And then there are other counties that have like one line that says anything you want us to know about your child. And they probably are not getting as great information. But more importantly, those kids are not going to have access to the same sorts of resources as the children that are in the other districts that are asking better questions, right? So this bill is really just designed to make sure that there's equitable access to resources across all 24 of our counties, and it's pretty simple that way. The counties can still come up with their own questionnaires. These are just the things that are guidelines that should be included in them. So they will have some guidance on that. I think that's, I'm trying to make this short for y'all since we're going so long. There's one technical amendment which makes changes to the advisory group membership and one amendment to clarify that the screening we're talking about is a parent questionnaire. So thank you for your consideration of House Bill 657. The bill will help all children in Maryland access equivalent resources for behavioral health support. Thanks very much.
Thank you, Delegate Guyton. We'll call the first witness, which is Catherine Carter. You have 2 minutes, Ms. Carter.
Can everybody hear me?
Yes.
Okay, thank you. I am so happy to be here back at Ways and Means. I'm Catherine Carter, Vision and Behavioral Health Advocate who worked on the Atticus Act. I am asking for a favorable report for this bill. It creates guidelines for current student health questionnaires that parents are already answering when they register their students, and allows parents to update their students' health and information annually. Several school districts are using these questionnaires to connect parents and students to local community resources, programs, and partnerships that they have developed. And I really ask that the members look at the end of my testimony where I really created a visual guideline of what's currently happening at the questionnaires. So please, please look at that. As you will see in these questionnaires that I put at the end of my testimony, they vary greatly among school districts, which can result in significant inequality. This bill allows parents to ask for help to support their struggling students and keep their students' health information that can impact their academics up to date. And once again, it's parent choice. It's parent voice. And this bill was inspired by the collaborative work with Howard County and can help kids like Atticus who could go misdiagnosed or lack the right vision accommodations. It can also help my daughter after struggling for a really long time to find a local health provider. I actually reached out directly to the school in desperation. I said, I can't find anybody. The pediatrician's list is outdated. And they gave me a list, and from there I was able to find a psychiatrist and a therapist that actually worked in conjunction with the IEP team. And my daughter made great strides in her IEP goals. In addition, when I registered my 5 kids this year, I was so thrilled to see the questionnaires that Howard County had added to their registration. I mean, questions like physical and dental health exam when the last one was. If a child has a vision problem, such as they wear glasses or contacts or cross eyes, it just brought a smile to my face, to be honest. And this would have been such a valuable tool for kids like Atticus, my daughter with her mental health struggles, and the parents of the 168 students we saw in 2020 with our eye exam clinic. The parents actually said the list of local providers was the second best thing they got that day, because they did struggle to find local providers. In addition, I want to say that parent engagement is the highest when they update their registration.
And Ms. Carter, can you give us your closing remark, please?
Absolutely. I want you guys to realize that my 7th grader who handed out the forms that on Tuesday said it's unfair that some kids get supports and others are not just because of where they live. I couldn't agree more, and I hope you see this bill not only gives parents with struggling students access to community resources they need, but help correct this inequality in our school system.
Thank you, Ms. Carter. Appreciate it. We'll go next to Martin Kerrigan.
Hi, good afternoon. My name is Martin Kerrigan. I'm a special educator working in Maryland Public Schools. I'm also the chairperson of the Maryland Traumatic Brain Injury, or TBI, Advisory Board. I'm here to offer favorable testimony to House Bill 657. According to the 2021 Special Education Census published by the Maryland State Department of Education, of the 111,315 students currently receiving special education services in Maryland, only 211 are identified as having traumatic brain injury, or TBI. At the same time, the Maryland Department of Health reported in 2017 alone, there were 4,794 emergency department visits and 210 hospitalizations for Marylanders aged birth through 18 with a diagnosis of TBI. This data has been consistent over the past 20 years. In 2018, the CDC published a report to Congress, The Management of Traumatic Brain Injury in Children, Opportunities for Action. According to the report, it is widely recognized that children with brain injury are underidentified for health and educational services and underserved by existing supports, placing them at risk for poor health and educational outcomes. The report states that a cause of the inability to access available educational services includes the potential underidentification of students with traumatic brain injury for special ed services. The report also found significant discrepancy between the incidence of TBI and the identification of children with TBI. One study suggests that fewer than 20% of students with a brain injury who likely need services are actually receiving them. In a recent survey, a majority of state special education directors reported that students with a TBI are not appropriately identified. They reported only 40% of students with TBI were actually classified under the TBI category. Students with a TBI were more often misidentified under other behavioral health categories or not identified at all. The nature of brain development can often mask problems from a brain injury for months or even years. Many times families do not make the connection between difficulties in school and a prior brain injury. Untreated traumatic brain injury can result in cognitive, social, emotional, and behavioral health problems, such as substance abuse, violent behavior, and an increase in criminal behavior. If we want to end the school to prison pipeline, this is one step that can be taken to help individuals who are at an increased risk of becoming involved in the correctional system. We are truly following the Individuals with Disabilities Education Act, then it is our duty and our legal obligation to make sure that we are properly identifying and serving students with disabilities. This is one more step that Maryland can take to continue being a national leader in public education. Please support all of our students and vote in favor of House Bill 657. Thank you for your time.
Thank you. Next, we'll have, excuse me, Frank Pantanella.
That's Patanella. Thank you. Thank you. Vice Chair,
Frank, good to
members.
see you, man.
Great to see you too. Members of the committee, thank you for this opportunity. I'm Frank Patnella, Senior Education Advocate for the ACLU of Maryland, and we strongly support House Bill 657. I want to highlight a call that I got from a parent who was desperately trying to find a mental health counselor for her daughter. Her daughter was usually very engaged in school and never exhibited any behavioral problems in class. But something happened. She suspects that the pandemic and being cut off from her friends had a significant impact on her well-being. And upon enrolling her daughter at a new public school in the city, she asked about counseling services for her daughter, but didn't hear anything back from the school. I called the district headquarters and they told me that this particular school had a community-based mental health provider. I gave the parent the provider's number and they were able to schedule an appointment with her and her daughter the very next day. Soon after, her daughter was receiving the help she needed. I just checked in with the parent and she was happy to report that her daughter is back to normal and doing well in school, and that she checks in with this counselor occasionally. This was a huge barrier to learning and it was quickly remedied. I've received a number of calls from other parents about the same issue early on during the fall when school reopened as children began their readjustment to in-person school. We have to be concerned about the number of parents throughout the state that don't have access to an advocate that can reach the right person to get these services. With the Blueprint plan phasing in, it is important to maximize access to services that are already there. The Blueprint Consortium on Coordinated Community Supports is already pulling together a network of community providers, and they will be expanding their work over the next years as more funding phases in under the Blueprint. House Bill 657 is one important way we can take a step forward to achieve this goal. Under this bill, parents will have the option to identify the behavioral health needs of their children during the enrollment process. And the more we can standardize and operationalize how data is collected from parents, the more coordinated and effective our schools will be for those that they serve. This is a common sense bill, and the best part about it is that there's no cost to the state.
Mr. Petinella, can you wrap, please?
Yep. Everything needed to make this happen is already funded. For these reasons, please give this bill a favorable report. Thank you.
Thank you. Next, we'll have Alan Tien.
Thank you so much. My name is Alan Tien. I'm the President and Chief Science Officer at MD Logics. I'm a psychiatrist and brain development scientist and public mental health scientist. I developed and taught a course at Hopkins for about a decade on the multi-level etiology of mental disorders, thinking about risk factors and so forth. So this bill to me is incredibly important. It's actually very short, but to bring to bear the maximum knowledge that is available to guide development of standardized student screening is so important. I fully support it. I'm offering an amendment. I was told that what I wrote was a little bit technical and too scientific, but it's really important in written testimony that I believe this consortium should have strong representation of various aspects of science on the as members to guide this standardized, to create the guidelines for development of standardized screening, which is also not a static one-time endeavor. It should continue to evolve and make use of data that's collected by the measure to then guide further refinement and extension and adaptation and improvement of the measurement, which has so many ramifications in terms of the data collected, how it can do many things to strengthen the overall behavioral health ecosystem, for our children and youth. So I fully support the bill and thank you for your time.
Muted, Mr. Chair. You're muted.
Thanks. Next, we'll have Samir Ahiato.
He's not here.
It's not here, okay. Okay, we have questions. Delegate Ebersol.
Thank you very much, Mr. Chair. So this is great because one of the things that we really need very seriously is children to be available to learn when they come. And as Delegate Guyton has pointed out, and so has my good friend Kat Carter, kids who can't see and various other things, we need to help them before we can expect them to begin learning. So it sounds like every county has something like this to do, and you talked about different levels of it. When we gather this information, what's the first step? Who looks at it? Who actually kind of files through it to see if there are things there? Who's the responsible individual, or what's sort of the procedure? And then I really don't want to know the whole thing, just who vets it at the start.
Yeah, thank you very much, Delegate Ebersol. I think that's a great question. I'll start, and I think actually Kat put her hand up to answer that as well. But I think right now what's happening is different than what will happen in the future, because what we're trying to do here is get ready for the implementation of the blueprint. This great idea was already put into that bill, right? It just has not actually come to fruition there. So this advisory group is really adding extra members just to work as an advisory to that consortium that we've already put together. At that point, it is that consortium's job to try to allocate those resources. But to answer your question for right now, what's happening, there are two answers. to answer your question for right now, what's happening is we've actually reached out to some of those school systems. And for instance, Howard County, which has this amazing questionnaire that has everything you could imagine under the sun on it, they actually spend the time going through in the nurses and counselors office to try to hook parents up with the resources that they know about now. So they're actually spending that time now in anticipation of what, hopefully will evolve through the blueprint. So it is being utilized. And then, if you're not collecting the information, in some of the other counties, of course, families aren't getting that resource. So
I agree.
I hope that answers it.
Well, the shorter answer would be the school nurse or the school health professional. That's the person who would first lay eyes on these and kind of vet them for potential problems.
Yep. Do you want?
I believe that's true. Kat also has talked to her school system. I think it may depend on school systems at the moment. But
I worry that it's,
Mhm.
you gather data, but then we have to make sure somebody actually uses it to do the very important things that you're talking about here. So
Sure.
I'm just curious if maybe we should lay that out in this bill and say, who should be responsible for, actually combing through it. It's a lot of work, but it's important work.
Right. Thank you.
Details.
If you would like me to answer that, I can.
Yes, Miss.
quickly.
Yes, Miss Carter. Go ahead.
I contacted my school nurse and she says that they actually are, because it populates the student data file, they actually have been contacting parents who indicated need. And then I actually had an IEP meeting this morning for one of my kids, and the staff says that the school nurse is actually, letting them know if a health issue arises for the special ed kid. And it's been very helpful for the special ed team. So because it's populating the data file, I think I do think process is important.
Somebody's still got to look at it. And, kids with IEPs, we pay a little more attention to those things with them. We have to make sure that we're catching all the good ones. Thank you. I'm sorry, Mr. Chair. That's commentary and not question.
Thank you for that question, Delegate Ebersol. If you don't mind, Mr. Chair, if I point out that in the blueprint, it's actually the behavioral health coordinators that are in charge of doing that in the future. So I think that's laid out a little bit better in the future than it is now, but we can certainly tie it down for right now. Thank you.
Yes, Mr. Tien, I think we got the answers to it already, but if you want to add one more comment or response.
Yeah, I just want to point out that's a great question. It's very important. There are good examples of how these issues are being addressed across Pennsylvania and Michigan, and they're working really well. So,
I do got just one quick question about. I think it's a great concept and great bill. I wonder if we are doing any physical assessments of students when they enter into the school system as well. Do we do any? Are those screenings happening or at all?
Not to my knowledge, sir. No, I think that's, they are required to have a pediatrician's note, saying that they have seen a doctor and have immunizations, but otherwise I'm not aware of it.
Got it. Fair enough. Okay. Any other questions for Delegate Guyton and her panel? Seeing none, thank you very much. That concludes the public hearing for House Bill 657.